You've probably heard this before, your acne means your gut is dirty, or just slap a star-shaped patch on your zit and it'll disappear. But is any of this true? I'm about to react to the most viral acne videos on the internet and break down what actually helps your skin and what could be making it worse. Hi, I'm Dr. Mamina triple board certified dermatologist, internist, and dermatopathologist. And today I am diving deep into some of the most viral acne videos online. Stick around because in the end, I will share my exact recommendations for treating acne safely, especially if you're dealing with hormonal breakouts, stubborn whiteheads, or post-inflammatory dark spots. So let's react to some of these videos. So I haven't seen these videos before, so this is a blind reaction. Let's get started. So there are many videos that circulate about like different locations of where acne is and what that means externally. And I think some of the things she says is actually correct, but some aren't really like evidence-based at all. Ones that we do know are correct are like when you do have acne breakouts on the chin or jawline, that's definitely related to like hormonal acne, usually something that we see in adult female acne. When we see breakouts in the T-zone area, that's most commonly related to people with increased oil production. That's where oil like congregates the most on our face. We see that a lot more so in like teenage acne, but of course like a lot of people can experience that. Yes, if we see breakouts on the cheeks, oftentimes it can be related to your phone or your pillow, or it could be some other reason that's unexplainable. She said that your forehead is related to irregular sleep. I don't know what the evidence is behind that. And then it's interesting because if you also look at traditional Chinese medicine, they say like, oh, if it's here, it's related to your kidneys. If it's here, it's related to your liver. I find that to be fascinating, but I think that we still need more evidence for that. But a couple of areas are kind of accurate. All right, let's look at the next video.
Things the internet tells you will break you out, but actually won't. Your pillowcase, your hands, brushing your teeth after washing your face, your phone screen, or doggy kisses.
Well, they may not necessarily break you out, but they can certainly break people out who are predisposed. Pillowcases, if they're not washed adequately, and some people can make you break out. Some people who aren't prone to acne don't break out. Same with getting kissed by a dog. I think it's a magic formula. And if you're prone to acne, you just want to minimize all those potential external triggers that there are out there. It's not like life or death, but there's so many different factors that can contribute to acne. So if you just can minimize like all the environmental things, then it'll help. But everything that she listed, those have been things that have been shown to trigger acne in some people, not everyone. And then the whole brushing your teeth after you wash your face, so that can potentially trigger something called perioral dermatitis, not acne. Once again, in predisposed individuals, not everyone. So all of the foods that she showed were foods that are rich in antioxidants and fiber, vitamin C, vitamin A, carotenoids, and all of those will only benefit your health and can benefit your skin. I'm not gonna say 100% that they're gonna prevent acne. Once again, acne is a multifactorial thing. Multiple parts play a role, whether it's your diet, your stress, your skincare. And yeah, but all the foods that she showed are wonderful foods that can help. I'm not going to say that your life is going to be transformed if you eat these foods, but these foods are full of great nutrients. Next one. Wait, I don't know what she did. Ice? And then, is that salt? And then a Band-Aid sticker. All right, so this is probably okay. Ice can help reduce inflammation if you have a really inflamed acne bump. It's not something derms wholeheartedly recommend because ice can sometimes cause like freezer burn on your face, so you have to be cautious with that, but it can help cool down and calm inflammation, calm down swelling, just like it can with like certain like injuries that you get. And then she put salt on there. I couldn't tell. I think it was salt. And salt can sometimes help draw out fluid, and then she just put a Band-Aid, the adhesive part of the Band-Aid on there. I would personally use a hydrocolloid traditional acne patch and not this. I could just potentially see it causing irritation. If you just use like a regular adhesive on a Band-Aid, that can also cause irritation in some people, especially if it's on an inflamed lesion. But yeah, I would say no to this.
This is going to blow your mind, but eating garlic can actually help get rid of your acne. Don't forget to read the caption.
This isn't the first time I've seen a video on acne and garlic. Garlic does have some antimicrobial properties. It has anti-inflammatory properties. It has other nutrients. She was listing here that it has B6, selenium, copper, zinc, which yes, are helpful for acne. It has antibacterial properties, like I mentioned. It doesn't compare to an antibiotic. Not saying that antibiotics are good for you, but in terms of its effect on acne, it's not going to be the same. It also has not been scientifically studied enough for me to say that you should definitely use garlic as an acne regimen. Now, having said that, I think garlic is an amazing food and should be incorporated regularly into one's diet. It has so many other health benefits. If you are healthy internally, then you can certainly have healthy skin. But I'm not saying that it should be one of the sole things you go to for acne. Doesn't hurt to try. It's super cheap, like whatever. You're just gonna get like bad breath and smell weird, but yeah, it's not like a go-to winning acne treatment. What is next?
Do you ever wonder what pimples you should and should not pop? Well, I'm gonna lay it all out for you. Emerging pimples like this should never be popped. Instead, using Pimple Correct will help eliminate these types of pimples with its pore penetrating salicylic acid. All you have to do is use overnight and apply up to 3 times per day. This type of pimple can be popped, but the better solution, you guessed it, Mighty Patches. Mighty Patches work best on whiteheads and for those with oily skin. All you have to do is leave your patch on for 6 to 8 hours and voila, all the gunk will be sucked up. Did you know that blackheads are a type of pimple? And trust me, you definitely don't want to be popping these. To help clear all this pore clogging buildup, use Pore Release. It's a gentle exfoliator that helps clear these stubborn blackheads and prevents new ones from forming. We recommend using it 2 to 3 times weekly. Hope this helps.
Okay, I love this video, even though it's a branded video from Hero Cosmetics. I think they're a great brand. They make great pimple patches, although my favorite pimple patches are from Personal Day. But anyways, I love this video because first of all, we shouldn't be popping any pimples, but if we were to pop one, she does point to the best example. It's like those ones that look like it's filled with pus, it's about to come to a head, ready to bust open. Those can be popped if done correctly. I usually tell people if you're gonna pop a pimple at home, have a sterile needle or lancet ready just to make an opening so that there's less pressure applied within the pimple, because it's the pressure within the pimple when you squeeze it that causes inflammation and like potentially permanent scarring, and it can just make the pimple worse. So I love this because it's better to just use a hydrocolloid patch on those things. And she first started with the emerging pimples to spot treat with salicylic acid. I think that's great. There's other spot treatments out there too, whether it's benzoyl peroxide. I also think it's good for everyone to be on a retinoid so that you prevent pimples from coming out in the first place. Hydrocolloid patches for like those ready to bust pimples, awesome. And then for blackheads, yes, I'm all about like using a salicylic acid based toner. Once again, a retinoid to help increase skin cell turnover so you're not building up all the gunk within your pores and yeah, and keeping them clear. I like this video. Okay, I think this video is supposed to be like cute, but basically, yes, a hydrocolloid patch. We love a good pimple hydrocolloid patch. And what it does is it essentially traps the contents of your acne under that patch, and it almost creates a barrier to pull fluid out of your pimple, and that's how it helps. It originally came about, these hydrocolloid bandages came about for wounds because it created a moist environment for wounds to heal, and it does the same thing in a smaller context for pimples. But anyways, I think the whole point of this is just a cute video of a whitehead being trapped under a pimple patch. Okay. All right, don't get me wrong. I'm a huge fan of hydrocolloid patches and they can definitely help, but this girl has severe acne and she has a lot of different cysts as well as smaller pimples. She has a lot of acne scarring. She hopefully, I don't know if she is, she doesn't seem like she is, but she should hopefully be on a really good systemic and topical regimen, because that's going to be way more important instead of just kind of hitting them when they're huge with an acne patch. You want to prevent them from coming in the first place. And so being on a good topical retinoid, being on a good topical spot treatment, whether it's salicylic acid, benzoyl peroxide, like a salicylic acid toner with a benzoyl peroxide wash. And then if I saw her in clinic, I would definitely put her on an oral medicine. And you know me, I'm a hippie. I love integrative medicine. I love talking to people about what else they're doing in their life that could be contributing to acne, whether it's their diet, their sleep, their stress, looking at potential supplements that could be supportive. But when you have a lot of scarring, if it's affecting your confidence, that's where prescription medicines, like the oral medicines, really come in handy. So anyways, that's what I would recommend for her. Like I said, hydrocolloid patches help, but she's gonna need more than that. Okay, next video.
If your skin has these tiny little bumps that never go away, they're not blackheads, they're not full-on pimples, they are closed comedones. It's type of a non-inflammatory acne that happens when oil, dead skin, and buildup gets stuck under your pores. While they look harmless, when bacteria gets in, it can turn into red, inflamed acne. So that's why cleansing properly is important, especially at night. You need a routine that clears out both oil-based gunk and water-based gunk. I always start with Anoa cleansing oil. It melts away sunscreen, makeup, and sebum without stripping. It's perfect if you have oily combination skin like myself. Then I follow up with the Anoa cleansing foam. It has salicylic acid which penetrates into the pores and wash the dirt, gunk, sebum out. Super gentle but still deep cleansing. Try these duo 3 to 4 times a week consistently and you will see a difference.
I like this video. She's right, closed comedones is a buildup of sebum and dead skin cells trapped underneath the skin, and it's the basis of an acne bump. So that's how they start, and then when bacteria get in the mix, they get inflamed, they can become larger, they become cystic. Those can become more inflamed, larger acne bumps. Now, when treating acne, salicylic acid is definitely an amazing ingredient. One of the cleansers she recommended is using a salicylic acid because it binds to oil and it can help pull oil out of the pores. I am a fan of oil-based cleansers for people with oily and acne-prone skin. It seems counterintuitive, like what, you're adding oil to your skin? Well, if you remember from chemistry, like dissolves like, and so that oil can bind to the oil in your skin, the contents, and help sort of dissolve and remove them from your skin. So I am a fan of double cleansing. Everyone's different. Not all acne patients benefit from oil-based cleansers, but I do think that they're helpful in this type of acne. And yeah, the other thing I would recommend for anybody with acne, even with closed comedones, open comedones, is get on a retinoid, like over-the-counter adapalene. You know, if you see a dermatologist, we could also do prescription retinoids, prescription strength adapalene, or tretinoin, which is Retin-A. But because that's going to be important for the keratin component that builds up in the pores and increasing your skin cell turnover. So yeah, that's the only thing I would really add for acne at this level.
Oh my gosh, is that not the cutest thing ever? My cystic pimple finally has a whitehead, so of course I'm gonna put a pimple patch on it. And I'm gonna try a new pimple patch on this. I got these from TikTok shop. It was literally 200 patches for $3.59. That is so freaking cheap, but I wanna know if it works. These are what they look like out of the box. They are so freaking cute. They're star shapes and come in 5 different colors. I don't know if you can tell, but there are a few different sizes here. Like these stars are smaller and these ones are bigger. Since this one is one of those big old cystic pimples, I'm gonna use the big star. So let's go ahead and stick this on. I'm gonna leave this on for the rest of the day. It's been about 8 hours and this is what it looks like. You can kind of see the whitehead peeking through. Got my handy dandy tweezers. Now let's get to peeling. Okay, it kind of worked. You can see a little whitehead on there, but a majority of it is still in my pimple. Wow, that is a big whitehead. Ooh, it's so liquidy. Okay, I can't show you what's on the napkin because it is very bloody, very gross, but I do see the whole whitehead in here. And honestly, I feel like most of it came out. I'm actually really impressed by these pimple patches. Not only are they adorable, they actually work. It only got a little bit of the whitehead on the patch, but I feel like this patch loosened up the whitehead that was inside my pimple, and it came out like pretty easily by just like wiping it. I think this gets my stamp of approval. Not what I expected at all.
Like I said, I love pimple patches, and I also am very happy that there's less stigma around people having acne. Like, I think wearing a star-shaped acne patch is considered to be cute and trendy. So I'm all about that because acne is so common, and I feel like we need to realize that it's something that 85 to 90% of people will experience in their life. So that's why I like the star-shaped patches, but her acne is pretty intense. It's moderate to severe. I would make sure that if you have this level of acne, before even resorting to pimple patches, that you are on a good regimen. I sound like a broken record. Using a retinoid, whether it's over-the-counter adapalene, tretinoin, Retin-A, and then making sure you're on a good cleanser, whether it's salicylic acid, benzoyl peroxide, or topical treatment, whatever. And then, you know, if I were to see her in clinic, I would probably prescribe her an oral medicine too. Now, I'm very happy that she decided to put a patch instead of trying to pop the pimple. I know she squeezed a little bit at the end, but I think the patch helped the pimple contents come out easier than if she were to like pop it from the get-go. It didn't seem like the pimple patch though did a whole lot. Like, it almost seemed like it just kind of removed the top layer of her pimple when she was peeling it off. So can't really comment on how effective it was in this situation. I also can't speak to the quality of these patches. She got like 200 for $3.50. I mean, it's probably okay. Yeah, I think this still goes to show that this should not be a form of treatment that you rely on if you have acne. The mainstay treatments that have been tried and true with a ton of scientific evidence are the retinoids, the salicylic acid, the benzoyl peroxide, and of course there's a ton of different prescription options out there too. But like I said, I'm so glad she used the patch instead of popping it.
I tried these hydrocolloid patches for my entire face, and to say the least, it hurt so bad when I was trying to take it off. I was planning to go back to sleep after filming this video, but these patches woke me up. These hydrocolloid patches are special types of bandages that absorb excess fluid like oils and pus and gunk out of your face. I put them on overnight for about 7 hours. You're supposed to put them on for about 6 to 8 hours. Also, don't rip it off so aggressively like what I did here. I was just so desperate because I knew it didn't work on my forehead. I'm not bashing on this product. I know it works really well on oily to combination skin, and I have dry skin, so that's why it didn't work.
So, like I said, I'm a fan of hydrocolloid patches. I don't think I'm a fan of the larger hydrocolloid patches for cases like this. I don't think she was the right candidate. By the way, I love Wendy. I think she's an awesome girl, awesome content creator. But as you can see, it was painful for her to rip these off. So she was almost giving herself, it felt like she was like ripping off nose strips. So she was, I'm sure, ripping off a little bit of skin at the same time. And we don't like that. We don't like causing trauma to your skin barrier and compromising your skin barrier. If you already use hydrocolloid patches, I would just make sure you're using the smaller ones where it's not affecting your normal skin. I think she has a lot of, I think her skin's nice, like it's healthy, it's normal, it's probably, she said it's on the drier side, so this is like even worse for the skin. Yeah, in general, I don't really recommend it. And if you have wide surface area of acne involvement, that's when you are better off using a topical retinoid, which you're supposed to use over your whole face to treat and prevent acne. I wouldn't use patches like this size. Okay, next video.
I was washing my face and I was like, why am I in so much pain? This pimple on the side of my nose is killing me, so let's get rid of it in one day. Starting off with a clean face, gotta get these killer patches. These have microdarts in them that actually penetrate skincare into the blemish to get rid of it quickly. 2 patches, and we start with the swipe. Next is the patch. Check out these microdarts. This is what actually penetrates into the pimple. Let's do it. You line it up, you stick her on, and then you just peel these off. I'll see you later today.
Well, I cried into my pimple patch.
Well, today was emotionally exhausting, like every other day. Let's see how we did. Oh! That's the goo. And that is what's left over. Pretty good, if I do say so myself.
Love Cassandra. She's an awesome skincare influencer. Also know her, met her in person. Anyways, so this is a good example of how to use a pimple patch. When you have like the occasional pimple that looks like it's about to bust, come into a head, love it. In her case, she also used the Microdart variant, which theoretically should potentially be a little bit more effective. I can't 100% say if it is. I don't know of any studies. I think that there have been like smaller clinical studies that brands have done micro patches and say that they're more effective. It allows any ingredients in the patch to penetrate the pimple more effectively. It definitely worked well for her. But like I said, I think this is a good example. She doesn't really get much in the way of breakouts, just the occasional, like if it's something pimply, you got to get rid of it quickly. You got to hide it as well. Pimple patch checks all the boxes. Okay, next video. Okay, so I like this video in that it also shows that chemical peels is a treatment option for acne. Now, I find it to be one of those more like backup treatment options. It's not something you should go to regularly. It's not practical. There's a lot of downtime. I mean, like her results were after 40 days from the chemical peel, and she still had a lot of like post-inflammatory erythema. Now her acne was pretty severe. I think that chemical peels is an option for people who aren't candidates for oral medicines, who get side effects from oral medicines, like with that level of acne, and you know, people who don't respond to topical treatments. So it's there, but I wouldn't rely on it. I am a fan of chemical peels more so. I recommend it more so for my patients who deal with a lot of back acne or a lot of acne scarring, especially on the back. It's so hard to apply medicine regularly on your back. It's just hard to reach. It's impractical. You have to put clothes on your back, you know, so it's, I think, more realistic option for that. But, you know, because the face, you have to like really protect it from the sun. The back, it's easier to hide from the sun. Anyways, all that to say is that it is an option to treat acne. It's not a go-to option, but definitely something that you could always have in your back pocket if needed. All right, last video.
Oh my god. Okay, so sometimes when I go out and I need to wear a mask, I like to use hydrocolloid patches to like protect my skin. And since I've been breaking out like this, I like to actually put on my skin. We're gonna peel it off. Ow, why does that hurt? This is always the most fun part, is to look at what it pulls. It looks like a petri dish. Now this one had a juicy pimple on it, and I went out for like about like an hour and a half. Ow, why does this hurt? Usually it doesn't hurt. It caught some like hairs. I think that's why it was so painful. But look, my pimple. My 2 petri dishes for the morning.
Okay, once again, y'all know how I feel about these larger hydrocolloid patches. I think that they can affect skin, like healthy skin, when you know it shouldn't. She was saying how painful it was when she was ripping it. So it ripped off hair, so you know it was ripping off skin along with it too, and causing micro trauma to her skin barrier. So I'm not a fan of those large surface areas. I do like how she was using it as a way to protect her skin from wearing a mask if she's prone to breakouts from wearing a mask, but in general, I don't think it's worth it to have this extensive surface area covered with these patches. But I do have to admit, it is really satisfying though, right? It's satisfying, it's fun, but I would say hold off, don't cause more damage to your skin. Use those retinoids, use a salicylic acid, use a benzoyl peroxide. There's other products out there. So some of these viral hacks are satisfying, some are risky, and a few are actually helpful, but most don't tell the full story. Your acne isn't just a surface problem, it's about inflammation, hormones, and skin barrier health. So if you're serious about healing your skin for the long run, skip the gimmicks and go for strategies that actually work and have been proven time and time again to be effective. Let me know in the comments what acne trend you want me to react to next, and if you want my favorite dermatologist-approved routine for breakouts, click right here. Thank you so much for watching, and I will see you next time.